Ashley.
안녕하세요. I'm Jin.
And we're from
I Wonder Korea.
Last week, we interviewed a nurse from Daegu, and she shared about her experiences. Daegu is actually the worst hit city in South Korea that had the COVID-19 outbreak. So what did you think about the video?
The video from last time, I think it was very informative. It's very helpful for foreigners because they only watch news about coronavirus on the news. I think it gave personal.
Now this week we are going to interview a doctor who is from Jeonju, and he'll be able to tell us what is true or false about COVID-19.
Okay.
All right, let's start. We are here today with a local doctor who will give us simple explanations about our most asked questions on COVID-19.
Hello, my name is K Park. I'm a general pediatrician. I've been working as a doctor for almost 30 years. I'm currently working with my colleague pediatrician in my group clinics in Jeonju, North Jeolla-Bukdo.
So, what is COVID-19 and what are the symptoms that we should look out for?
COVID-19 is one of the coronavirus. It's the new coronavirus. The patient who get infected, they usually have the fever, sore throat, cough, sometimes the shortness of breath. When you have this kind of symptom, especially the shoulder difficulty in breathing, you need to go to the doctor's office first.
We have true and false questions here that Dr. Park over here will enlighten us and give us more information. So let's find out what is true or false. Your hands is better with soap and water is better than using antibacterial gel. Is that true?
Yeah, that's true. It's clear that washing your hands, the soap and water, can kill all kinds of germs and then remove the dirt, some kind on your hands. But the alcohol-based hand sanitizer cannot kill all kinds of germs.
I see. What about drinking water every 15 minutes? A family member of mine told me that it would help prevent COVID-19.
That's not true.
False.
Yeah.
Wow.
But because the drinking of water, it's kind of the good health habit. Stay your body healthy, but it's not specific remedy for the preventing the coronavirus.
Wow. Okay. Wearing a mask at all times when you go outside, can that help from spreading the coronavirus? Is that true?
That's true in some parts, that's false in other parts.
Really?
Yes.
True and false. Okay, so can you explain more about that?
According to the CDC's guideline, if you are sick, you need to wear a mask. But if you are not sick, if you are healthy, you don't need to wear a mask unless you are not caring for the sick person.
Okay. So if I am a nurse or doctor, it's helpful for me to wear a mask because I'm taking care of someone who is sick.
Yeah. But the Korean CDC guideline recommends the people to wear a mask
everywhere.
Yes, when they go to the crowded place.
Yes. I usually don't wear masks, but I like to wear it when there's crowded people because I don't know who's sick or not.
Yeah, I know that there are a lot of the talks about the mask in Korea. I think the mask should be saved for caregivers, medical staffs, and then the elderly people, and also the people who have the serious medical conditions.
That's true.
Yeah, the masks are the precious resources for them.
Also heard that drinking vitamins can also help prevent getting the coronavirus. Is that true?
That's false.
False. Okay.
Taking vitamins, it's not a specific remedy for preventing the coronavirus. In contrast, the excessive taking vitamins can cause some side effects.
Oh wow.
Yeah, be precautious.
Wow. Okay. Heard people think that gargling with mouthwash and warm water with salt helps. Is that true?
It's false.
False. Okay, so gargling with mouthwash or salt water does not help prevent the coronavirus.
It's not evident that the gargling with the water and saline can't prevent the coronavirus. But the gargling makes your throat feel better.
Oh,
but
I see.
Yeah. But the excessive gargling can cause some irritation and dryness in your throat and mouth.
Wow. Okay. Some articles say that leaving your mask under the sun to disinfect it, you can lengthen the use of it and use it again. Is that true?
I think that's not true.
False. So you shouldn't use the masks. They're disposable. You should use them one time.
Yes, right.
So that's why we have a shortage.
Yes.
I see.
I heard that the UV light, the sunlight, it cannot kill the coronavirus.
Okay.
And also they cannot lengthen the function of the mask. According to CDC's guideline, don't use it again.
Don't use it
Just
again.
discard it.
I see.
If the mask become contaminated and humid,
Yeah,
it can become a source of another infection.
I see. I also heard that young people are not at risk, whereas old people and those that have pre-existing conditions, they're the ones at risk. Is that true?
That's true in some part, the false in other part.
I see. So, can you explain more?
Yeah. It is very critical question at this time because so far, according to the data, mainly from the China and South Korea, most of the cases are older patients. But in Korea, the younger patients, the percentage of the younger patients has been increased. But 한국말로 해야 이틀 전에 US CDC에서 발표된 자료를 보면 전체 코로나 바이러스 때문에 입원하는 환자들의 30에서 40% 정도가 그 밀레니엄 세대들 20에서 40세 정도 되는 밀레니엄 세대들이 입원을 하는 걸로 알고 있습니다. So the report concludes that all adults of all ages should be precautious.
Yes,
To take care of themselves and others.
I see. And what do you think about the vaccine? Is there going to be a vaccine on the way, or what can you tell us about that?
So far, we don't have the specific vaccine for COVID-19.
Okay.
But I heard that some of the vaccine are being developed and tested in next month. So, but it will take at least 1 or 2 years.
So as our final message, what is the most important reminder that you would like to tell everyone? And there are many people that are also very much worried.
Here the 2 times the pandemics as a doctors. The first time is the 2009 flu pandemic, and second one is the COVID-19. I'd like to compare 2009 pandemic with the COVID-19. I searched online how normal Koreans remember the 2009 event. And I found that most of the Koreans didn't realize what had happened at the time. And also the people who got infected at the time, they usually said it was normal, it was the minor, it was like a common cold. But on the contrary, I remember this event as a panic phobia and smallness as a doctor, because there were 700,000 people got infected, and over 200 people died of the pandemic flu. And every day, 5,000 cases has developed at the time. Most of them are infant, children, and young adults. There were many patients in the clinic. We couldn't afford to take care of the patient, even though we extended working hour until 10 p.m. on Sunday. There was chaos. But after the developed and the introduction of the new drug like the Tamiflu, and we prescribed them to the patient, and then after that, the pandemic has been started to stabilize. So nowadays, we have more efficient public healthcare systems and advanced medicine and technology, and you are having a valuable lessons from the previous pandemics.
That's true.
Yeah, so we can get through this difficult situation if we can come together as one.
It was great. What do you think, Ashley?
That was a really good experience. I believe that was so informative and better than searching on Google.
Yes.
Actually,
I want some more. What's the next of our next series?
Next on the series, we'll be talking about someone. We'll ask them about their first-hand experience. They got tested to see if they had COVID-19, and we'll see how that goes here in Korea.
Okay, thank you for watching us, and please subscribe our YouTube channel.
Yes.
Bye-bye.
Bye.